Hello, this is Dr. Mario San Bartolomé, your family physician and addiction medicine specialist. I want to talk to you about a question that comes up all the time and is very, very frustrating. Oftentimes, I get this question from parents who have noticed that their child could have been exposed to some chemicals, that they might be using drugs, and they say, well, hey, Dr. Mario, what do I do? Where do I go? I don't know where to start. And so they start Googling and they get some very expensive rehab on the top of a hill in Malibu, or they'll get something that clearly is not what they're comfortable with, even trusting, the kind of, some strange treatment using some strange drugs. They don't even know if it's medical, and everything in between. So where do you start? Well, my recommendation would be to first start with your primary care office. So if you have whoever your primary care doctor is, or your community clinic, your local community clinics, they will often have some capacity to be able to screen and diagnose. And then if they don't have the services that are needed at the clinic, then what they could do is they can actually refer. And there's different levels of care depending on what the person might need. Some of it may be outpatient, so we don't go to a facility and stay there. You just go and visit it and leave the same day. And then some of them can actually be what we call residential, where you actually go to a facility and stay there for a period of time. And usually that means that that person needs a lot more support, both medically and also from the standpoint of the social services as well. Sometimes there can even be other things that complicate it. So for example, somebody might have a psychiatric problem along with the addiction issue. And so for that, there are actually programs that are what we call dual diagnosis, that they can take care of both the psychiatric side as well as the part that has to do with substance use disorders. So it can all seem a bit confusing, but my recommendation would be to first zero in with your community clinic, your primary care office, and start the process there for the correct screening and for the correct referral to treatment if they don't have the services.